My name's Travis Alexander. I'm a postdoctoral fellow in the medical humanities program at Rice. We're having another interview today as part of the Translational Health for Public Humanities website. And we're joined by Dr. Rebecca Garden, who's an associate professor of public health and preventative medicine at Upstate Medical University. And she's going to talk to us a little bit today about a class that she's been teaching called Culture, Communication, and Ethics, Deaf and Disability Approaches. So Dr. Garden, if you could just tell us a little bit, what is your sort of academic background? What's your path to get to this work you're doing now?
Yeah, so my background is I'm a literature PhD and was working on that at Columbia in the English department, actually during the AIDS epidemic, and was sort of navigating that personally. My close friend was dealing with AIDS, sick with AIDS, and eventually dying of AIDS while I was in grad school. And that drove my focus, sort of channeled me into really looking at literature that represented illness and cultural and social responses at a time when medicine really couldn't do very much. So I was working on 18th century studies and, ended up responding to a job ad from Rita Sharon, the MD, PhD in literature, who founded the narrative medicine program at Columbia, and ended up being the managing editor of the journal Literature and Medicine, working with Rita on the narrative medicine program, was eventually associate director, which is how I became, aware of this world of medical humanities, which I now, like others, kind of talk about it as health humanities. And it was just a really kind of mind-blowing encounter. And I ended up in a medical school in central New York, where initially I was in bioethics and humanities. And I think, like a lot of literature PhDs, I ended up teaching bioethics without having any training in it. And that in itself was like a really fascinating encounter with a kind of alien culture, in the same way that, my experiences in medicine were. And so I did a lot of ethics retreats with medicine residents and teaching bioethics to medical students, hearing a lot about bioethics consultations and cases, even though I wasn't doing them myself. And then sort of separately got involved in what is called the Consortium for Culture and Medicine. And this is this wonderful interinstitutional collaboration between my university and originally two others. One has since dropped out, but Syracuse University and Lemoyne College, which brings together in seminars students and faculty from those different institutions. So while I was doing this really kind of normative education in bioethics, I was also teaching electives, and basically really interested in representations of disability and deaf studies, looking at first-person narratives related to illness and disability, and then eventually developing the course that I have now. And so this is an opportunity to not only teach in an interdisciplinary way, but to have students from different professional programs and different disciplines and majors coming together and sort of teaching each other across those differences. So it's probably a longer answer than you had anticipated, but I think that these origin stories for people in health humanities are pretty interesting.
Yeah, they really are. I wonder just, this is a topic of some fascination to me, but as one of the side points you mentioned is that at some point you dropped the term medical humanities for health humanities, which is a choice I've made as well, but I'm curious to hear why you made that choice and what you think, what kind of precision or ambition is availed by that terminological shift, at least in your own work.
Yeah, I don't know if it's precision, but it's moving in that direction. The students that most often took my course from Upstate Medical University were nursing students. And nursing students and professionals are really conscious of the kind of hierarchical distinctions that are made, and the ways in which references to medicine exclude them. And I think much of medical humanities really has done that. Sort of the traditional conventions around medical humanities were really so physician centric. They have been. So part of it was to be inclusive of nursing students and nurses. Most of my students were working nurses. And then part of it was to also address distinctions between healthcare providers and patients, where, the term health is meant to be more inclusive so that, I was coming into this with, a certain amount of knowledge of how people living with AIDS, people who are dying of AIDS, were themselves doing care, like not only mutual aid, but direct action, citizen science, and then cultural responses to the epidemic. So I wanted to better recognize that as being part of the discipline and shift from the physician centering to more kind of recognizing the knowledge and expertise in communities and in patients, or in people who don't want to be called patients.
Yeah, to switch gears back a little bit, in terms of the course itself, I noticed on the materials you submitted to the Translational Humanities website that one of the topics you focus on is food insecurity and food access, especially as they have intersected with disability communities and have been refracted through the COVID pandemic. I wonder if you could talk just a little bit about how that interest plays out in your course and what sort of skills you teach students kind of about it.
Yeah, so I had taught the course in 2015. It was really oriented toward deaf studies at the time. I was co-teaching with a deaf law professor from SU, Michael Schwartz. It was really focused on exposing students to different communication modalities, including working with interpreters, setting up different modes of access around communication, including captioning. And then I hadn't taught the course for a while. I switched departments to public health. COVID hit, and then I revived the course in response to a couple of things. One is the challenges the students themselves were having around issues of access in the early days of the pandemic, and I think still have in different ways in terms of, access online. Do they have good enough broadband and technology to be able to sustain the online education? What did it mean for students who were expected to go back on campus and have to be, exposed in different ways? So, it was kind of like navigating that, wanting the course to address that in certain ways. And then was also seeing in my community, Syracuse and Onondaga County, where we really have incredibly high rates of, poverty, really profound disparities around health and access, really profound differences in terms of, the sort of suburban ring around the city itself, in terms of, just issues like income and life and expectancy and so on, and seeing how much COVID just blew that open and exacerbated those inequalities. I had been working since the beginning of COVID, just in a volunteer capacity with an organization related to the food system and food policy, the Syracuse Onondaga Food System Alliance. And so I, just basically made an arrangement with them. They were doing surveys of people who were accessing food through food pantries And one of the questions on the surveys was, would people want to talk more about their experiences of food insecurity? So I was able to get that contact information and set up those opportunities for my students in the course. And so the students were coming into this themselves. I think almost all of my students in fall of 2020 had parents who were essential workers, who most of them got COVID. It was a pretty scary thing through the semester as they were going through that. So they were themselves navigating vulnerability in different ways related to COVID. And, it was just a really incredible way for them to sort of navigate their personal kind of anxieties and rage and outrage at that time about the ways in which the pandemic was being handled, and to just gain expertise and tools for addressing these disparities and inequalities. So basically I set them up with a set of keywords, which were the readings, formed the readings throughout the weeks. And those keywords include things like cultural humility, structural competency and structural racism, disability justice, I'm trying to think, food sovereignty and food insecurity. And so these were like little chunks of theory and then, research and analysis related to each of these sort of models or tools or approaches. With deaf and disability, sort of studies frameworks as, kind of lifting up that structural analysis. So I set them up with the keywords and also wanted to empower them with an arts-based research approach. So in a lot of ways that I was really inviting them to, sort of express themselves in different ways in different modalities. So they were either, the materials and media they were consuming are like a whole array of, visual arts, video, text, really just offering different modes of expression and representation, and then doing the same with them, engaging them to do drawings and create comics or zines as much as, any kind of like written textual response. They did a lot of audio files rather than, just writing everything and being on their screen all the time. So that kind of opened up those, that framework of universal design for learning to them as students. And then, they had the opportunity to do these interviews with people who identified as, having food insecurity, but often ended up talking about other issues that were really haunting them and plaguing them during the pandemic, during the lockdown, like isolation and depression. And the students also had the opportunity to interview different community educators who joined us through Zoom for the class. So people who I have like longtime connections with in the community, like, a community gardener, community activist who identifies as bipolar, who herself is navigating food access issues all the time and has like a really rich sort of set of resources for dealing with all of that, but it was all kind of upended by the pandemic. The students were able to sort of collectively interview people like her. So just a whole range of riches.
Absolutely. So just maybe by way of finishing up, I wonder, do you have any sort of forthcoming work or work of your students that people could look up to see kind of like some of the payoff that this course and the research that's come out of it is already having?
I don't have that yet, and I really should, because over the semesters that I've done this now, I have students who have made zines. I have students who have, one student choreographed a performance, like we moved beyond COVID. And the student did a dance performance related to the experiences of injured workers. I've had students just do like photo voice projects, a whole array, but I haven't really figured out quite yet how to represent all of that. I think the one text that's most related is what I published in the Front Matters section of Literature and Medicine in the fall of 21, which is about pandemic narratives. And I really, it's a kind of story. I'm sort of exploring the self-awareness about where we're at in terms of like imagined immunities and imagined communities, and how the stories that we're telling now are really shaping our long-term responses to what the pandemic has sort of laid bare for those of us who are too privileged to have seen it otherwise. But it's also a kind of narrative about the research that I did myself during the pandemic, when, I was able to just spend time, for example, channeling the stories of a deaf new American, a deaf refugee who has had repeated experiences with communication barriers at local hospitals, and was able to tell her story, or just transcribe her story really, and get that into print. So I think that's probably the best representation of that pandemic moment for me.
All right, perfect. Well, I will echo that and encourage people to go check out your piece in Literature and Medicine. Again, you said that was fall 21?
Yeah.
Okay. All right, well, thanks for stopping by and telling us a little bit about this work you're doing. It really sounds fascinating.
Thank you.